My name is Libby, and in terms of what am I focused in clinically, my research and my clinical focus for three diseases: multiple myeloma, Waldenstroms macroglobulinemia, and amyloidosis. So Waldenstroms macroglobulinemia is a very unique disease, and although it has many similarities in general to lymphoma, in particular indolent lymphoma, it's not the same. And it's the fact that it's not the same that makes it especially interesting to me. It also has some relationship to multiple myeloma, or what's called plasma cell diseases, and I see a lot of patients with multiple myeloma. And in some ways I think of it as a hybrid disease between lymphoma and multiple myeloma. Around the country and around the world, it's often, probably much of the time, perhaps the majority of the time, it's multiple myeloma physicians also assume the specialty of Waldenstroms macroglobulinemia because the treatments are very similar and the behavior of the disease is somewhat similar. Throughout my career, I've for some reason been interested in rare diseases, and so I've also taken care of, for many years, some other very rare forms of blood disease like hemophilia. And again, I find myself interested in rare diseases like Waldenstroms. As I said, the way it manifests, the symptoms for patients are quite unique. One of the really unique symptoms is something called hyperviscosity, where your blood can become very, very thick from the protein that the lymphoma makes, that the Waldenstroms makes. And if you have very, very thick blood from Waldenstroms, you have to have your blood, have that protein removed from your blood urgently, and it's essentially an emergency. That can be a big problem depending on where you live. Here in Seattle, we can get it done 24/7, 365 at our center. But if you're in a smaller community, it may be close to impossible to get this thing called plasma exchange to have the proteins removed. Things are moving ahead rapidly in Waldenstroms. It's a very unique and rare disease, and I enjoy collaborating with investigators from around the country to care for these patients who really can't get expert care anywhere else but in a large academic center like this one.